The aim of this study is to investigate the effectiveness and safety of angiotensin receptor-neprilysin inhibitors, we call that ARNI, in real-world patients with reduced ejection fraction heart failure, as HFrEF patients, and advanced CKD patients with an estimated eGFR less than 30. Basically, these kind of patients were excluded from the landmark clinical trials, such as the Paradigm Heart Failure Study. And our results demonstrate the mortality benefits of ARNI therapy in patients with HFrEF and advanced CKD. Hello, I'm Dr. Qian Yishu from Taipei Medical University Hospital. I'm the leader of our heart failure team in the cardiology department. I'm also the assistant professor of Taipei Medical University in Taipei, Taiwan. It's my privilege to report our study results here on behalf of our research team. Our article, entitled as Real-World Experience of Angiotensin Receptor-Neprilysin Inhibition in Reduced Ejection Fraction Heart Failure Patients with Advanced CKD, will appear in this issue in the Mayo Clinic Proceedings. Heart failure is a challenging medical problem worldwide. Comorbidities are prevalent in patients with heart failure, and the complexity of the comorbidities are related to the severity of the heart failure disease itself. And approximately 1/3 of patients with chronic heart failure have a coexisting chronic kidney disease. And the reduction in renal function has been associated with increased mortality and hospitalization in patients with chronic heart failure. And sacubitril/valsartan is a first-in-class angiotensin receptor-neprilysin inhibitor, which was abbreviated as ARNI, has shown to reduce the risk of cardiovascular mortality and heart failure hospitalization among patients with heart failure and reduced ejection fraction in HFrEF patients, as compared with the ACE inhibitor enalapril in the pivotal study Paradigm Heart Failure trial. Furthermore, sacubitril/valsartan has also been associated with a slower decline in renal function and significantly lower drug discontinuation rates due to renal impairment compared with enalapril. However, patients with an estimated GFR less than 30 were excluded from Paradigm Heart Failure study, and limited evidence is available to support the use of ARNIs in HFrEF patients with severe CKD. And in this study, we tried to analyze two Taiwanese multicenter cohorts with patients with HFrEF to assess the potential beneficial effects of ARNI in these patients with advanced CKD. And in this study, we examined more than 3,000 patients pulled from two multicenter HFrEF cohorts, and totally 661 patients with a baseline eGFR less than 30 were further analyzed. The propensity score matching was performed to adjust the confounders. At 1 year follow-up, all-cause mortality, total heart failure hospitalizations, renal function, and LV ejection fractions were used as in study endpoints. And after propensity score matching, totaling 510 patients were included in the final analysis, including 278 patients receiving ARNI therapy. It's called ARNI treatment group. And 232 patients did not receive ARNI treatment. It's called non-ARNI treatment group. The baseline characteristics are comparable between the two groups after propensity score matching. At 1 year, the eGFR and LV ejection fraction measurements were significantly higher in the ARNI treatment group than in the ARNI treatment group. The ARNI treatment group has significantly lower risk of 1 year all-cause mortality and total heart failure hospitalizations than non-ARNI treatment users. I think the main findings of our study can be summarized as the following. First, the majority of CKD patients with stage 4 and 5 patients could tolerate ARNI treatment in the eyes. Secondly, the incidence rates of all-cause mortality and heart failure hospitalizations were significantly lower in patients receiving ARNI than in those who were not receiving ARNI treatment. And third, the patients in ARNI group had higher eGFR and LV ejection fraction at 1 year of follow-up than those in non-ARNI treatment group. In brief, I think our study results show the mortality benefits of ARNI treatment in patients with HFrEF and advanced CKD. This population was basically excluded from the Carter Hospital trial, and our findings support the role of sacubitril/valsartan in HFrEF patient treatment with a baseline eGFR less than 30 in a real-world setting.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.